Hello, welcome to our YouTube channel. My name is Sonia. On this channel, I talk related information on nursing, medicine, and healthcare. If you are just joining us for the first time, you're welcome. Please click on the subscribe button and join us so that you'll be notified anytime we come online to share important informations like this. And if you are a returning subscriber, thank you for always watching my video. On today's video, we'll be talking about pelvic inflammatory disease. We are going to know all about pelvic inflammatory disease today, what causes this PID, the treatment for this PID, and the prevention. Pelvic inflammatory disease, also known as PID, is a condition whereby some parts of the upper female reproductive organs, such as the endometrium, the fallopian tube, and even the ovaries infected. And this infection can even cause swelling of the uterus, which can go as far as affecting the uterus, that's the pelvic peritoneum. And when this happens, it can even cause a permanent damage. Now, someone will ask, what is the causes of this PID? PID are mostly caused by sexually transmitted disease. These bacteria include chlamydia, gonorrhea, and even E. coli that causes UTI. Can also be a cause of this PID. We have some cases where bacteria enter the reproductive tract during childbirth, miscarriages, when the evacuation is not done properly, or we even have some cases in abortion. When these bacteria that causes infections are left untreated, it can spread, cause inflammation, and even becomes chronic. And once it becomes chronic, it can lead to infertility to the host. Not only infertility, it can also cause tubal ovarian abscess, whereby there will be pus in that particular area. It can also cause ectopic pregnancy, whereby the fertilized egg that is supposed to travel through the fallopian tube into the uterus is being stopped on the way, and rather it will now be implanted in the fallopian tube instead of the uterus. And when this happens, it can really be a life-threatening situation. Also, it can also cause the risk of infecting your sexual partner. So that is why it's advised immediately you have been diagnosed or you suspect PID, you have to treat it immediately. The most common symptom of this PID is the abdominal pain, and this abdominal pain is usually occurs in the lower left and lower right of the abdomen. That's when you divide your abdomen into 4 equal parts. From the navel here, from your navel, you come down the right and the left part. When you touch it, or when you're feeling pain around these regions, then you should be suspecting PID. Another one is pelvic pain. When you're having pelvic pain, either in any of the side or at the center, then you should also be suspecting PID. And the most especially when when there's tenderness or you feel pain when they touch your adnexal area. The adnexal area is the area below, just below your abdomen here, and that is the center where the uterus is located. So when you touch or push and you feel pain or you feel tenderness there, then you should be suspecting PID. So another point is dysuria, when you're having painful urination. Another one is the dyspareunia, when you're having painful intercourse. Another thing is abnormal bleeding, when you have bleeding when you're not supposed to, or you have spotting, either maybe when you have sex you start having spots of blood, you should be suspecting PID. Another thing to look out for is fever. When you're having fever greater than 38 degrees Celsius or 38.3 degrees Celsius. We have vaginal cervical discharge, whereby the discharge is mucopolorent. That means discharge is have combination of the mucus and a pus, and when this pus is coming out, it have a bad smell, then you should be suspecting PID. Then another symptom is fatigue, whenever you are feeling tired, and this tiredness normally occurs due to the inflammation of that particular part that has been affected by this bacteria. What are the treatments for this PID? PID can be treated with oral antibiotics, and the particular antibiotics is usually decided after a diagnosis, like a laboratory culture and sensitivity test is being conducted. Then the particular drug that is most susceptible will be concluded on, and that drug should be taken at least for 2 weeks, that is 14 days. But if still the symptom doesn't clear up, then an IV, which is an intravenous infusions, will be introduced to clear up the infection. And if there is an abscess buildup, a laparoscopy is conducted to drain off the fluid or the pus from the system. Now, are there ways to prevent this PID? Yes, there are ways to prevent PID. Number one on my list is limit your sexual partners. Limit your sexual partner, because the more sexual partners you have, the more you are exposing yourself to this particular infection. Also, if you are to have sex, you have to practice safe sex method, and that is you have to use condoms. Don't have unprotected sex, because this will expose you from getting this sexually transmitted disease. Number three is early detection. Treat that PID immediately you are diagnosed of it. Don't allow it to spread into your upper genital tract, like the fallopian tube, the ovaries, the uterus, before you start treating, in order to save yourself from the damages associated with this infection. Another point, avoid self-medication in order to be properly treated. Just imagine you want to do self-medication, you just end up buying any drug you like. You don't even know if your bacteria that is disturbing you, if it's gonorrhea, if it's chlamydia, if it's E. coli. You don't even know the particular bacteria that is causing your infection. So why not visit your hospital and let your doctor, your gynecologist tell you the particular drug to take in order to eradicate this PID for you. Another point I want to leave before I go is avoid douching. If you douch, please, I'm begging you, stop it. It's not good. You are only tempering and upsetting the pH of your vagina, and when this pH is being altered, it can in turn cause UTIs, that's urinary tract infections, which would then be another problem you'll be fighting while there's nothing wrong with you initially. I advise that you stay away from douching and practice a healthy vaginal lifestyle. Don't forget to tell your partner to go and test also. Everyone needs to know his or her status. So know if you have sexually transmitted disease and treat it at once, in order for you not to pass the infection to another person, or either not for you to cause more damages to yourself. Remember, they say health is wealth, so you need to be healthy in order to make wealth. If your genitals is not healthy, man, you're not healthy. So if you found this video helpful, please subscribe to our YouTube channel. Don't forget to like and share this video, especially to those who think this video might be of help to. Thank you very much for watching my video. I'll see you in my next video.